St. Mary's was looking at some places where we could improve, and one of the things that was discovered was that our documentation in the patient record was not as accurate or as specific as it could be. So administration kind of embarked on this journey to create a clinical documentation improvement program and department.
The clinical documentation specialist role is that they are reviewing the record concurrently, meaning as the patient is in the hospital. The clinical documentation specialist will be looking for indicators to support diagnoses or clinical indicators to support questions or what we call queries of physicians to get accurate reflection of what actually is going on with the patients.
What makes the program here at St. Mary's unique is it takes highly skilled, highly trained nurses from the bedside into a different role as a nurse. Still taking care of the patient, but taking care of the patient in a different manner. We're looking to tell an accurate and complete patient story while they're here.
The importance of having experienced nurses is that they can actually relate with what they're seeing in the record, looking at what isn't being talked about in the record, indicators that they need to look for accurate reflection that they can use when they're asking questions of the physician.
As you can imagine, the physicians were a little bit skeptical through some just working in partnership with them, helping them understand why we're asking the question and what we're asking them to respond to. They really have done quite well. When the quality of documentation has improved, the downstream effect is increase in revenue, money that we may have been leaving on the table because our patients didn't look that sick on paper. One of the main benefits on the patient end is the primary care provider gets a much more accurate picture of how sick that patient was here at the hospital.
The team is evolving as we learn, as we go along, the more time we are involved in it. And I think that everybody's getting better at their job the more that we learn. It's an awesome team to work with.
There's been several months that nearly 100% of the queries have been addressed and answered. There's been a group of physicians who every query that has been sent to them, so every question we've asked them to clarify, they have answered and responded to. I mean, in this kind of program, being this new, that's phenomenal.